Schools, golf courses, gyms, malls, movie theaters are reopening, even areas hardest hit by COVID-19. But if you are in the high-risk category, you're over the age of 65, you might be wondering just what is safe to do again. Expert in aging health, Chief Medical Officer of LCR Health, Dr. McClain, joins us to share how to keep our seniors safe. Good morning to you and welcome. So let's start with this, Doctor. With COVID restrictions lifting, is it safe for people over the age of 65 who are at high risk to return to normal daily activities?
Well, of course, it depends on what you call normal, but it's certainly not safe to be outside yet like it was 3 or 4 months ago. We don't have a cure yet. We don't have a vaccine yet. We have some treatments, but they're, as Dr. Fauci said, they're not a knockout punch. So you're definitely increasing your risk, especially if you're in the over 65 and or you have what we call comorbidities like hypertension, diabetes, obesity. Even if some of those are controlled, obesity can't be, but the others can be, you're definitely increasing your risk by going out.
So let's say my father, he's 65 years old. We want to go to the beach. We're allowed to go now. We're allowed to lay out. What do we do? What precautions do we take? How do we help them, guide them through it? What should older adults take into consideration when venturing out?
Well, you picked a good one, because going to the beach is something that makes some common sense because there's ways to distance yourself from other people. You're in an area where there's plenty of ventilation, obviously, and those are the considerations that that seniors or anybody should take into account when going out and trying to resume a normal life. On the beach, you don't have to be packed into one another, but in a gym situation, you've got a closed environment. Even an office situation, you've got a closed environment, and you've got more of a risk the more people you pack into that closed environment. I think the beach is a safe choice as opposed to, say, a gym, certainly.
Is it safe for older people to have visitors come to their homes now or attend parties at friends' homes, families' homes? What would you say? And I know that's indoors now. Now we're talking about indoors.
Well, and that kind of begs the question, based on what I just said about the office. It really depends on who you're dealing with, right? And in my office, we've all agreed that it's a team effort, right? We're all quarantining and being careful with social distancing because we have to work together day in and day out. And with a family situation, it's the same idea. Friends, certainly there's testing available now, more so than I think the public is aware. And so if they're willing to test and you're willing to test, and make sure everyone's safe to begin with, and everyone's also practicing as well as can be practiced the safe protocols, then again, it's still an increased risk, but it can be modulated downward by taking the standard precautions that we're trying to take.
Dr. McClain, what are some of the most common questions that the seniors in your office are asking you that you seem to answer over and over again?
Probably the most frequent question is regarding masks, because there's a lot of information out there that's not necessarily misinformation, but it can be misleading. The mask that everyone is being asked to wear, that the cotton mask or the equivalent of maybe a bandana, is going to reduce your own risk of transmission by about 10 to 30%, depending on what study you read. But it definitely helps the community in general because it helps the other person not get it from you if you're infected, more so than the other way around. There are better masks. Everyone's probably heard by now of the N95 or slightly lesser in value, the KN95s. But even the surgical masks are a little bit better than the cotton masks. But as a community, it is better for all of us to wear masks right now for certain. And that's the question I probably get asked most often.
Yeah. What about the mental health of our seniors? I mean, just like the rest of us, we have been on lockdown, but this entire time it's really been focused on seniors as well. And some of these seniors, they haven't left their homes to even go to the grocery store. So the mental health of it all.
That's a tough one, and that's something that's been addressed. I see it more in other countries, actually. Think about it. You're I don't want to say you're in the last part of life, but you're in the latter part of life, right? And this is where you want to get out and mingle with your friends. A lot of people over 65 are retired, and these are the golden years. And yes, here they're being, quote unquote, ruined by this virus. Again, I go back to your earlier question. You can find friends at this point that are willing to quarantine and practice, the safety measures as much as possible. and attempt to get together with them. And even, it doesn't have to be in a closed environment. It can be out by the barbecue, on the beach, as you mentioned earlier, so that there's always a little bit increase of risk if you're going to associate with other people, because that's the main source of transmission. But there's ways around it, and definitely from a psychological standpoint, every effort should be made to start folding that in to the mix at this point.
Can I quickly ask you something about the most common way of transmission? The WHO initially came out, just recently came out and said asymptomatic people, not as many people can give the disease, can give coronavirus to other people. Then they kind of stepped back and said, well, no, asymptomatic people can still transfer COVID. What say you?
Well, Eric Topol and his associate did a very good study that shows you definitely can transmit if you're asymptomatic. But I think more important to know recently is that what we call fomite transmission, grabbing a doorknob that has been touched by someone who coughs in their hand, for example, and then touching your own face, seems to be a less likely source of transmission than person to person through the breath, the droplets from speaking, or aerosolized particles from speaking or coughing. So that's probably more of the latest from the data we've gathered so far that's important.
Dr. Rand McClain, thank you so much for joining us this morning, answering some important questions.
My pleasure. Thank you for having me.
Yes, great to talk to you.